I'm Elisa Bass. I'm a registered nurse and I work with Angelina College. What we've prepared for you today is a video that covers our peer assessment. The peer assessment is a well assessment that is performed on a patient that's not hospitalized. Earlier in the semester, you studied about the bedside clinical assessment. That's to be done on a sick patient. It's a more focused and shortened version of the version that you're going to see today. As you know, the peer assessment is a large part of your grade in 1215, your RNSG 1215 course. There are specific criteria that you must meet in order to make the highest grade possible. On page 27 of your RNSG 1215 syllabus, you will find all of the criteria that must be met as an examiner or as a patient on the day of your peer assessment. As you see, the examiner responsibilities: you must wear your scrubs, bring a black pen, a pen light, and a stethoscope. You will perform the physical exam at the time that you signed up for. You'll document your findings without the aides in a room that is separate from where you did your assessment, and then you'll turn in your documentation. If you are being the patient, you must complete all of the identifying information on the Angelina College Nursing form, the assessment form, on page 32 in your RNSG 1215 syllabus. Please go ahead and fill out all of that information that you can to make it easier for your examiner. You must also wear a patient gown, which we will supply. It will be available in the lab. And please fasten your hair back if you have long hair. It will make it a lot easier for the examiner to get to your thorax and the cardiac area. So what you're about to see is just an example of a peer assessment that we performed just to give you an idea about how one goes. My name is Elisa Bass. I'm going to be your nurse today, and I'm going to be assessing you. What is your name?
A.L. Thornton.
Okay. I want to go ahead and talk about some of the confidentiality issues that we face today in healthcare. New legislation has passed, and just to protect your privacy, if that is what you wish, we can use initials and we can cut that out. It's strictly up to you. We wanted to make sure that it's okay that we're videotaping this exam and that we use your name. Is that okay? All right. Okay then. You've already filled out this history, the Angelina College Nursing Program Assessment Form 1. And I've been reviewing it, and I just had a few questions. I wanted to fill in the blank, okay? I want to talk about your family history. Does anyone in your family have heart disease, hypertension?
Not that I'm aware of.
Okay. What about diabetes?
No.
Okay. Stroke? Anybody ever had a stroke?
I think my grandfather has.
Okay. What about cancer?
No.
All right. That's great. I'm going to go ahead and make those revisions on your health history form. Okay. All right. The first thing that I want to do is I wanted to go ahead and let's test your vision, okay? I'm going to preface this by saying that I've already washed my hands. All of those things that you would normally do prior to interacting with a patient have already been done, okay? Just come with me over here and we're going to go ahead and test your vision. You'll just come right over here and stand. Do you see the tape on the floor? I know it's going to kind of just stand with your feet right there. And I'm going to give you this. And you don't have to put any pressure, but I'll have you cover one eye or the other as I go over here to the eye chart, okay? And we'll just test your vision right now, okay? Okay, you're going to cover your left eye. And if you could, just go ahead and read the one below the red one since you think you can. Why don't you just try the one above it, the one above the red line?
D-E-F-P-O-T-E-C.
Great. Now then, cover the other eye. Now I want you to read that same line backwards, okay?
C-E-T-O-P-F-E-D.
Okay. Now then, you can just look through both of your eyes. What's the lowest one you can read now?
F-D-P-L-T-C-E-O.
Great. All right. All right. We're done with that. I'm going to go ahead and get your height and weight. Okay. So have you had any weight loss or gain here lately?
I think I gained a couple pounds.
Really? You were trying?
Trying to.
Okie dokie. I think these scales really are kind to women. Okay. And if you would, just turn around. And I'm going to get a quick measurement on you too. Just stand up as straight as you can. And I'm putting this down because I'm going to need both hands. Okay, you can just step out from under it now and go get on the bed. You can just take a seat back on the bed. I'm going to go ahead and get your vital signs. I also wanted to add, for those of you who haven't been through this whole process, if you're in the hospital, during your peer assessments, of course, if it is applicable, you would want to wear gloves, which I've got my gloves over. You can't see them, but I will use them when they're appropriate. If in the hospital you are dealing with anything that has the potential to contaminate you or your clothing, if you're irrigating wounds, if your patient is particularly sick and is vomiting, you would want to wear eye protection as well. So I just had these here. He's fine. I'm going to put them to the side, but had I needed them, they were here for my use. There you go. Okay. So when was the last time that you actually went to the doctor?
It's been a while because I haven't had.
You've just not been sick at all?
At all.
So do you recall what your last blood pressure was?
It was normal.
Okay.
I called it exactly.
Okay. Never had a problem with hypertension.
No,
And I noticed from your history that there's nobody in your family, so that is great.
So I need to relax my arm or just.
Yeah, I just want you to kind of lay it right there. That'll be just fine. Okay. And your blood pressure is just fine. I'm going to go ahead and take your temperature too. Just under your tongue. You can close your mouth. That'd be great. You're perfect. That's a rare instance. Alrighty then. You can go ahead and record that. Okay. All right. What I'm planning on doing today is just a head-to-toe assessment. Okay, I'm going to start right at the top of your head and we're going to work our way down. I'm going to do a lot of touching and feeling, and I'll try to explain to you as I'm going along kind of what I'm doing and feeling for. Sometimes I may double back and cover an area again. Don't be alarmed that there's something wrong. Usually it just means that I forgot something and I want to swing back over there and pick it up, okay? So just to make it a little bit more comfortable for me, I'm going to raise your bed just a little bit, okay? So tell me if you have to jump and run because we don't want you to hurt yourself. Okay? All right. Now then, this is a little bit more appropriate height for me. Again, I'm going to start at the top of your head and we're just going to work our way down, okay? Right now, I'm just kind of feeling for any abnormalities in your head, okay? Now you had told me prior to starting the interview process that you had had an old head injury, and I feel that scar right there, okay? There are lymph nodes that occur and they will swell as part of your body's immune system, and that's kind of what I'm feeling for right now. They happen all along there. Okay. This is an important area too. I'm going to go ahead and touch right over your clavicle area. Okay. Okay. That's fine. I need for you to make some funny faces. We can test some cranial nerves. Well, that one was good. Okay. The big smile was really good. I need you to broad smile. Okay. Now crinkle up your forehead. That's good. Okay. You can open your eyes. Tell you what, I'm going to go ahead and just test your ability to perceive light touch. I want you to close your eyes, and I'm going to touch you in some different areas of your face, and I want you to tell me where you're feeling them, okay?
Left side.
Okay.
And the right side. On my cheek.
Okay, which one?
Left cheek.
Okay.
Right cheek. Chin.
See, you've got kind of a half beard there, and so we'll leave a trail. Did you feel
On
that?
the right side.
Okay. I'm going to go ahead and put on my gloves. Now you can open your eyes. I'm sorry. Just left you sitting there with your eyes closed. I just kind of want to take a look inside your eyes. I'm not going to do an ophthalmic exam. I'm not going all the way into your eyes yet, but I do need to kind of touch your eyelids and look inside, okay? Alrighty, can you look down? Okay, is there any pain at all?
No.
Right through here? What about through here?
No.
Okay, what about here?
No.
None? Even when I press? No? How about here?
No.
Okay, great. You notice any tearing, anything like that throughout the day? I know you study and you play basketball, so you don't have any visual problems at all?
No.
Great. Okay, we're done with that part. Now then, I just kind of want to test to make sure that your eyes are seeing normally and are parallel and everything. Okay, just try to keep your eyes open. I'm going to shine a light into them. What I'm looking for is your pupillary response. Okay. Very good. Okay. Just look straight ahead. Look straight at me. And I'm just going to shine a light right at your nose. And looks good. What I was looking for is that the light was hitting your eyes in about the same spot. Sometimes, especially younger children, there's an imbalance there, and what can happen is one of the eyes will be turned in, okay? Just to double make sure that everything is fine there. I'm going to have you look at a spot on the wall back here, and what I'm going to do is cover one of your eyes, and I want you to keep looking at the spot, okay?
All right.
Same spot, all right? That's great. Keep looking. Okay, and your eyes didn't even move, so that's great. Right now what I'm doing is I'm testing to make sure that this pupil over here reacts when this one is stimulated. And yours does. Let me get the opposite direction there. Okay, looks great. All right, well that was really good. Right now I just want to test and make sure that the muscles around your eye are working appropriately. What I'm going to have you do, I'm not going to turn this on, I just want you to look at the tip of it and then follow it with both of your eyes. Keep your head really still, try not to move your head at all, just follow it with your eyes, okay? So far, so good. We're halfway done. And this is my favorite part coming up. That's where I want you to follow it in, okay? I just do that to make you cross your eyes, that's all. So, okay, enough about that. Your eyes look really good. What I'm going to do now is I'm going to move on to your nose. I just want to kind of look inside and see if anything's going on there. You've never had nosebleeds or anything like that. What about seasonal allergies? Do you have a problem with that?
Not a serious problem.
No? Do you have to take meds sometimes during pollen season?
Yeah.
Okay. I'm just going to look up and just see if there's anything really visible. Looks great. Okay, nice and clear. I'm going to occlude one side, and I just want you to kind of breathe in and out through the side that's free. Okay, other side. Okay. Have you noticed any changes in your sense of smell?
No.
You can smell odors? Okay.
Fine.
All right, then that's great. When was your last dental visit?
Probably a year ago.
Okay, any problems with your teeth?
No.
No missing ones, everything's fine.
Everything's fine.
How often do you brush and floss?
Brush once, maybe twice a day.
Let's see, twice is good. What about flossing? You do that?
Not really.
Okay, well, you know, we want to go ahead and recommend that you get in the habit of doing that. Okay, all right, I'm going to look in your mouth, and I promise I won't gag you, okay? Just need for you to open up real wide so that I can see. Oh, that's great. I don't even need really the tongue depressor, okay? Can you say ah? I'm going to do it one more time. Stick your tongue as far out as you can. Very good. Okay. Lift your tongue way up. Great. Okay. I'm counting your teeth. Alrighty, 28. So, when did you have your wisdom teeth removed?
Haven't.
Oh, they haven't grown in yet.
No,
Okay, well that will happen sooner or later. I'm going to move on to your ears now, okay? Earlier I had kind of swapped across here just to make sure that everything was even, and I see that it is. There's no tenderness there. Let me know if I'm causing you any pain. Sometimes I, get into what I'm doing, and if I'm hurting you, just let me know.
Everything's fine.
Okay, great. Have you noticed any changes in your hearing?
No.
None? You're able to hear everything in the classroom that you need?
Fine.
Okay. What I want you to do, I'm just going to do just a brief assessment on your hearing. It's called the whisper test. If you could just take one of your fingers and cover up this ear, and I'm going to whisper something over here, and you tell me what I whisper.
Cover it up totally or just?
Yeah, just stick a finger in the canal there. That'll be fine. Okay? 99.
99.
Okay. Let's do the opposite ear. 42.
42.
Okay, that's great. Problems there. This is an otoscope. I need to look inside your ears to see if your tympanic membrane is fine. You're kind of in an awkward spot for me.
You like me to scoot up?
Yes, do you mind terribly? Just scoot up, not to the point where you might fall off the bed. That would be bad, okay? Because, as I said before, you're really, really high. Tell me if I'm causing you any pain. A lot of times this just feels like it's going to cause some pain. Kind of freaks people out a little bit. Okay, how do you normally clean your ears?
Q-tips.
Okay, you don't go all the way inside, right? Okay, because if you jab those Q-tips down too terribly far, you can actually end up injuring your tympanic membrane. It's a lot closer than what you think. Your tympanic membranes look great. They look great, okay? I palpated your lymph nodes a while ago. Right now I just want to make sure that your trachea, that's right here, is midline. Okay, and it is. And right now I'm just feeling for your thyroid gland, okay? Normally it's not palpable. Okay, just want you to swallow, okay? I know that's hard when somebody's got a big grip on your neck there. So, all right, that felt just fine. Right now I'm feeling of your carotid pulse, okay? Nice and strong. Okay, I just want to see how mobile your neck is. Do you ever have any problems with your neck at all? Okay, just kind of lay it over like this and over the other side. No pain?
No pain.
Okay, see how far up you can look and down. And now twist it from side to side like that. No pain at all? Okay. I'd like for you to just kind of push against my hand. I'm going to see how, turn your head like that against it. Okay, good. Other side. Good. Okay, now then I want you to clench your jaw, and I'm going to try to open your mouth. Good. Now then shrug your shoulders up against my hands, okay? Great. Nice equal strength there, okay? I'm going to go around to the back now, and I'm going to start feeling of your vocal sounds through your chest, and I'm going to listen, okay? Okay, Mr. T, if you could just lean your head forward. I'm going to be kind of pressing on your spinal cord or column here to identify some landmarks, okay? All right, that is C7. There you go. And you tell me if you feel any tenderness, I'm causing you any discomfort, okay? No pain?
No pain.
Okay. Now then, what I'm going to have you do is just take a really deep breath and let it out. There. All right. That seemed to be equal expansion there. I'm going to take a listen to you, okay? My stethoscope is probably going to be a little bit cold on you. I'll try to warm it up a little bit. Okay. First I'm going to listen up here. There's just actually one spot of the lung that you can hear. Take a really deep breath in through your mouth and out. Alrighty. And out. Okay. In and out. Again. Okay. If you'll just breathe in and out through your mouth, you don't even have to exaggerate it. I think I'll be able to hear. Go ahead. Good. I'm going to circle around up under your arm and out. Okay, that's great. All right. While I'm back here, I'm gonna tap you pretty lightly on your back, and you let me know if you feel any tenderness. Okay? Any pain, tenderness?
No.
Okay. All right, then I'm going to move around to the front. We're going to do something very similar on the front. Now then, we're going to do the front side. Let me just lay this down. Do you mind if we go ahead and just put your? Are you too cold or anything?
No,
Because just to get at the front part of your chest, I kind of need to lay the gown down. Okay. You can, I mean, if it's bothering you there, you can do whatever you need to with your hands, okay? All right. First of all, I'm going to listen to your breathing again on the front side, and then I'm going to listen to your heart sounds. Don't think that anything's wrong. We do a lot of touching and feeling just to find some landmarks, and what else we do is we're listening in several different spots, because when we do that, we can listen to different valves, different heart valves. So don't be alarmed that I'm listening too long or anything like that. That's especially important with our moms. When you're doing that to their children, they get especially antsy, but I just didn't want you to be alarmed that I'm hearing something abnormal, okay? First, I just want to listen to your breathing. Deep breath and out. Okay. Now then, let me just kind of count a little. Okay. Okay. Right now, I'm feeling, a lot of times you can feel the heart as it's beating. And that's what I'm trying to find, is where your point of maximum impulse, we call it the PMI. And there it is right there, and that's at just about exactly where it should be. Right. We'll do some listening now, okay? And you don't just breathe normal, okay? One more time, I'm just going to go through and listen with this, okay? Okay, that's great. I'm going to have you just lay back on the bed now. Let me move my papers out of your way. I know that's probably not very comfortable, is it?
Laying down is comfortable.
Tired of sitting up. Sorry, we put you through the meal today, haven't we?
That's fine.
Okay. You want to go ahead and
45-degree angle, you got them at. Hi, I'm Ellen Duke. I'm an RN and I'm Alyssa's examiner today. So I'm just helping her out on the cardiovascular section, a particular interest area of my own. And so during this time, what we do when someone presents to us is with any kind of cardiovascular distress, or if they're presenting for a health history, as you are today, we inspect their neck veins
Okay.
because they kind of give us a clue to what's going on in this ticker.
Okay.
So we have to have you at about a 45-degree angle to do that. What we do is we kind of ask you to just kind of turn your head to one side. We kind of have what we call tangential lighting, so that we can kind of look and see if we can see your neck veins. And if at a 45-degree angle we really can't see any neck veins, then we know that you probably are in good status as far as your fluid status, as far as your cardiovascular function. The neck veins that we are looking for are actually the jugular vein. It is you have external, meaning kind of on the outside, and internal jugular veins. And if they happen to be evidenced, like someone that's heart is working very hard and the blood is backing up, and so it's getting up here high, then we do what we call kind of a look-see measure of their central venous pressure. Because if we draw a line from the highest level of pulsation out to here, and right here, I'm not trying to tickle you, count your ribs, you have 12, and you can really tickle a little kid when you go to count their ribs anyway, so that's mean. We look here, and this is called the sternal notch right here, and you can feel it on yourself. And then you go down to the top of the sternum, which is called the manubrium. In the middle of that is a notch there. Right below that notch, I can feel it on you because you have good bones. Right below it, if we actually drew a line straight down here, would lie the right atrium of your heart. So we imagine that that's where it is, because truly that's where it is.
Okay, I just want to listen to you again. I'm just listening to the heart right now. The thing that I didn't do while you were sitting up is I just wanted to feel your entire chest wall just to make sure that there's no vibration. Sometimes you can actually feel the heart kind of vibrating, some turbulent blood flow. You can feel that on the outside. I didn't hear anything abnormal, but just in case, I'm just going to go ahead and do that now because I forgot to do it while you were sitting up, okay? And again, I'm going to find that PMI. It's just right there. Okay, one more time. Go back on my diaphragm side. And just breathe normally. Just listen to the heart sounds. Okay, now then I'm going to move on down your belly and do a little pressing there, okay? First thing I'm doing is I'm just kind of looking just to see if I see any visible peristalsis, anything weird. I don't see anything bizarre with you, okay? I'm going to do this a little bit different. Normally I feel first, but with the bowel sounds, we can't do that. We need to listen first, because in hospitalized patients, we can sometimes make bowel sounds happen just by pressing around, and so then once we get to the listening part, we think everything's fine, and it may not necessarily be so. So I'm going to listen first, and then I'll do some poking, okay? Okay. Okay. You didn't eat lunch, did you?
Not
enough.
Not enough.
Your belly's hollering at me that it's hungry. So, have you noticed any problems as far as your bowel habits, as far as eating? You don't experience nausea or vomiting?
No.
Okay. Are you comfortable
Yes,
as far as
ma'am.
the temperature and everything? Because we could cover you back up if you need
No,
at this point. Okay. I'm going to do just a little bit of palpation on your belly. Are you hurting anywhere?
Not at all.
No place at all.
No.
Okay. Now, when was your last bowel movement?
Yesterday.
Okay. Was it formed?
I really didn't look at it, so.
Oh, okay.
Just usually,
All
I
right.
guess.
Did it seem your usual
Yeah.
pattern? There's nothing changing.
Nothing
Okay.
changed.
In order to just help me kind of get through your musculature here, I just need for you to lift up. That'll kind of help to relax, okay? And again, my hands are probably kind of cold. All right. I'm just going to do light palpation on you. We've not really encountered any problems. You're not having any problems. And, you know, the latest research shows that deep palpation can disturb things. So I'm just going to just do this light palpation, okay? I don't feel anything at all. Okay. Now, I'm just going to kind of lower your shorts just a little bit, okay? And do a little pressing here. When was the last time you voided? You urinated? Your bladder's not full?
No.
That's basically what I want to make sure, okay? Alrighty then. Now, tell you what, I'm finished with the upper part of your body for the time being, so if you want to go ahead and put your gown back on just for your comfort there. Right now I just want to make a quick check over your pulses and take a look at your peripheral vascular system, okay? So I'm going to be touching you usually on both sides,
Okay.
but we'll talk about that in just 1 minute, okay? There you go. On your carotid pulse, it's real important that we not palpate these together.
Mm-hmm.
If we do, it can cause you to pass out. That's not necessarily good, is it?
No.
It's not a good thing. You're laying down, so it wouldn't be the worst thing in the world, but it would be good. Alrighty. Okay. I'm just going to kind of expose you for a second here. I'm going to run my hand just down the side of your shorts here. Sorry. I'm feeling for your femoral arteries right here. While I'm down there, I'm just going to go ahead and make a quick check of any lymph nodes that might be in that area that could be swollen, okay? Do you practice self-testicular exam?
Yes.
Okay, good. So as you know, testicular cancer can be a big problem in the age group of 15 to 35, so that would be really important, okay? You just lift your knee up like that, okay? That's good. Okay, other side. That one is real hard for me to do together, so I'm just going to kind of compare. Okay, just going to swing down here. You can just relax your legs, feeling for the pulses here. This is your posterior tibial. I'm going to have to take off your socks too, just for a second. While I'm down here, just to include everything while we're here, because I know that your feet are kind of cold. I'm going to check a couple of things while we're here, okay? Right now I'm feeling around for your dorsalis pedis. We call them pedal pulses sometimes. And yours are nice and strong, nice and strong. Have you noticed any problems with the sensation in your feet? No? Not at all? Okay. Okay. So what happened to your toe here?
I stubbed.
You stubbed it? Yeah? Okay. What looks like? Right now I'm pressing around. I'm just kind of seeing how fast your capillary refill time is, okay? You're kind of cool, so sometimes that makes it a little bit slower than normal, but I can see that it's pinking back up, so that's really good. While I'm down here, let me just go ahead and I want you to just kind of slightly bend your knee, and I'm going to push up like this. Do you feel any pain at all through here? Your calves are just so well developed. You can relax that again, okay? It's okay. Over here. Any pain at all right through here? That's great. Okay. I'm going to put your socks back on then, okay? And we'll move on to the musculoskeletal examination. The reason why I was doing that test on your leg is the Homan sign is what we do to test for deep vein thrombosis. People that are inactive or have sat for a long time on cross-country road trips, sometimes plane trips, they get clots that can actually turn loose and go to their brain and their lungs and cause major, major problems. So that's why I was checking your legs that way. Okay? I just want you to kind of swing your legs over and sit up in the bed, and I'm going to go ahead and do your deep tendon reflexes and test some muscle strength here, okay?
Right.
Before I do a lot of poking and prodding, I'll go ahead and do your deep tendon reflexes. You know, I haven't really looked at your extremities yet, but I want to do cap refill here too and just see if there's any. Notice you've got a tattoo there. Just going to go ahead and do an aside here, okay, about tattoos. You need to be especially careful with your tattoo parlors because that is a major way of transmitting hepatitis B, okay? So there's your lecture for today. Can't go back, but anyway. All right, I just want you to squeeze my hands really hard, okay? Good, okay. Now, I'm going to try to go ahead and get your deep tendon reflex here. Just kind of relax your arm. There you go. Let it dangle, okay? Okay. One more time. All right, saw a little jump there. Just going to have you relax right there is good. Relax your arm as much as possible, okay? Okay. There. Now then, just want you to kind of put your hands right there. That'll be fine. We'll just see if we can do this. Don't see anything. Okay. Now then, scoot forward just a hair. That jumped a little. Not as good as that other one though. That other one was better. It really was. Okay. Oh, that was good. Now then, the other thing I'm going to do while I'm down here is do something we call the Babinski reflex. And you have absolutely no response, and that's what we want. In order to do this, all you're doing is just putting a flat surface and you're just running the outer parameter there of the foot and ending at the great toe. I'm going to do it on the other side and make sure that that is normal as well. Nothing. That's great. Okay. You know what, while I'm down there, I know that looks kind of scary, okay? I want you to close your eyes and just tell me if you're feeling something and where you're feeling it, okay? Close your eyes.
On the top of my left foot.
Okay. Whereabouts?
On my second toe.
Very good. Other side.
On my right foot on the second toe.
Okay. That's good. I'll go ahead and put your socks back on one more time. Okay. While you're sitting, before we get you up, I'm going to go ahead and test some muscle strength, okay? I've already noticed that you've got well-developed abdominal muscles in your thighs. So how often do you actually work out?
Every other day.
Okay. Is that associated, do you do that independently of your basketball practice? Because we know that you're a basketball player. Okay. Make a fist. I'm going to try to pry your fingers open. Okay. Now then, just lock your wrist. I'm pulling against that. And then now I want you to just really lock against that. Okay. Now then push against me. You can actually turn around and just push. Okay. Let's do the same thing for this side. Okay. Okay. Yep. Turn around and push against me. Okay. Now then, I'm going to kind of pull up and I want you to push down against me if you can. Okay. Can you lift up on your thighs? Good. And push against. Okay. And we had already determined that. All right, I'm going to lower the bed and let you get down, and we're going to do a little range of motion and walking, and I'm going to look and see how steady your gait is, okay? All Right now, more of the kind of drunk test that's really, you see it on TV all the time with these reality TV shows, but really is testing a portion of your brain just to make sure that your balance is there, okay? If you can, just put your feet together, and I want you to close your eyes, and I'm going to stand here pretty near. Are you feeling any dizziness or anything like that?
No.
Okay, you can open your eyes. Normally, just a little bit of swaying is normal, but what we're looking for is if somebody has to jab their hands and feet out like that, that would be abnormal, okay? Well, I've got you up. Let's just do a little bit of range of motion. I want to make sure that you can move those shoulders. Lift them up as high as they can. Okay, put them back down. Now then, just kind of move your elbows a little bit. All right, can you swing your hips out like that? Any pain? No discomfort at all? What about the other side? You noticed any? Yeah, you might want to move away from the bed before you bop yourself. Okay, that's good. All right, while I've got you standing here, I want to look at your spinal cord alignment, okay, your spinal column there. I just want you to kind of face this way, and I'm going to explain something to our students just so they understand, but you don't have to even absorb any of this, okay? On your checkoff sheets, there's something called the AP to lateral diameter. That ratio should be about 2 to 1, and what we're talking about, this measurement across should be roughly 2 times the measurement from what we call the AP measurement, okay? So this should be twice as big as this. It's a 2 to 1 ratio. That's what we expect as far as normal. With some breathing disorders, with COPD patients, what you'll see is this will even out. They get kind of barrel chested, and so the diameter will be like a 1 to 1 ratio. This will equal this, and that's not normal, okay? While I've got you on the side, I'm going to kind of look at the curvature of your spine. You've got 3 normal curves, your cervical and your thoracic and your lumbar, and yours is in the expected, the normal shape. I just want to look from behind. Okay, you've got just a little bit of a curve, but not much. Okay, I want you to just bend over and kind of touch your toes, and I'm looking to see if there's any asymmetry, and I think you're fine. Okay, let's stand up. I had made a note about the slight curvature in your spine. It's just a normal variation, probably as a result of just a slight difference in your leg length. But if you're not having back pain and you're not having any problems with it, just won't even address it. You can just go back and have a seat on the bed, and let me just one more time glance through and make sure that I didn't leave anything out. And I'm going to go ahead and record a couple of things here. Do you have any questions before we wrap things up?
Was anything?
Everything looked absolutely great. Your vision is great. The only thing that I would stress to you is that you probably do need to go ahead and arrange for regular eye exams and regular dental exams, just so that things don't go way far bad. You're doing a lot of reading here in school, and so if you start having stinging, burning, so you're having to really squint, I would go ahead and get your eyes checked, but your vision checked out absolutely normal in your 20/20, okay? All right, well, I'm finished. Do you have anything else to add? Excellent. Thank you,
done.
and we thank you so much.
Yes, we do. Now tell us when your first basketball game is.
I don't know when exactly the first game is,
Okay.
but the season starts in November.
Okay.
Okay.
I'll be looking forward to seeing you though.
All right.
Okay.
And which number should
14.
we be? Number 14.
Number 14, we
Number
can remember
14.
this.
Well, do you mind if I conference with her for just a minute
that's
here? Alyssa, this was an excellent job.
Well, thank
you
you.
so much for doing this. As you can see, that I always make multiple notes on the physical assessment performance evaluation that's filled out by everyone. Doesn't mean that anything is wrong with it. It's just your tool after I finish with it to give to you. And I can tell you, you absolutely did a beautiful job and really didn't miss any areas at all. I only have a couple of suggestions
Okay.
for improvement. On the area of, and maybe a few questions to
Okay.
clarify, in the area of, did an excellent job with palpation for PMI. Did you compare and contrast the apical
did
radial
not.
pulse rate?
I did not.
So that's okay, no problem there. You did such a wonderful job in the other areas that I really felt like there wasn't any need to readdress that.
Okay.
In the hospital setting, as we're palpating for the PMI, though, you know that it's probably best to go ahead and compare apical to radial rates to notice any disparity, because what happens is usually whatever we put out at the apex of the heart perfuses to the radius simultaneously. In some disease states, and it may be cardiac in origin or otherwise, for example, in a condition called thyrotoxicosis or Graves' disease, that sometimes there's disparity there, and somebody can get a cardiac abnormality, meaning that the apical rate puts out a lot more beats than the radius is perfused to, and we get what we call a pulse deficit.
There you go.
All right. So in his case, of course, we didn't have that problem, but it's just something that we would want to attend to. You didn't ask him specifically about the 3 magic questions that we always address with level of consciousness. However, I don't think there's any question with me. We'll just ask him those magic questions
for
right
hints,
now to add it into your dialogue.
Okay.
Would you mind telling us your initials? We're going to do that.
Yeah, we'll just do initials.
Unless you want to do your full name for the tape.
He said it was okay.
My initials are ALT.
Okay.
ALT. And could you tell me what year this is?
This is 2003.
All right. And could you tell me what place you're in?
I'm at Angelina College in activity.
In health careers
Health
1, but
careers.
you don't have to be
No,
that.
I'm going to ding him on that one.
I think you.
Okay.
I think
well,
he's,
you're all right.
I think he's a-okay. You want to tell me the state and the place? We're in Lufkin Land.
Lufkin, Texas.
And you're all the way from
Memphis, Tennessee.
All right. How about that? Okay. So those are our 3 silly questions that we ask our patient. Sometimes we have to check in with ourselves to make sure we're oriented to time, place, and person.
There you
too.
go.
Alyssa, I believe that you have, out of the possible 75 points here, 74 of those.
Ooh,
And
okay.
because I only took away one measly
Well, there
little
you
point.
go.
And
Okay.
if you do well on your write-up, you will have a 99.
That would be great.
Wouldn't that be wonderful to
Okay.
average in with RNSG 1215? Now,
Okay.
another study tool that our students are using that we want to refer to them in our syllabus is RNSG 1215. It is their last unit, and it is an integrated adult physical assessment guide, and it looks at every system, the procedure, the usual findings in every system, and some comments and variations that we might see in a less
Healthy.
healthy and
Subject.
a little bit older.
Yes.
You know, as we start to age, some things start to change a bit. And so those variations are there. We're also in the process of preparing pediatric variations. So a column is being added to our health assessment class here. So I believe we're just going to show a slight female variation, and then we're done for today.
I think so.
Thank you.
Hi, I'm Elisa Bass, and I just wanted to demonstrate to our students a few variations that are factors in examining the female body. What was your name?
Samantha.
Okay, all right. The first thing that you're going to notice about Samantha is that, you must stand up just for a second, and I want to demonstrate to them what we've got going on here. Just kind of turn sideways. We've actually got 2 gowns on her, and that really kind of helps when you're doing the peer assessments, because this bottom gown opens up in the front. They can tie that, and it covers the breast. The one on the top is going to open in the back. That way, when we lay her down, we can just lift up this part and still get to everything we need to without totally exposing her. We can use the bottom gown kind of as a veil against the breast, and this top one is going to totally obstruct the view and retain her modesty and all of that. Okay?
That concludes the physical assessment portion of your peer assessment, which is worth 75 points of your total grade. Your instructor will use the evaluation criteria that is included in your RNSG 1215 syllabus, starting on page 28, to grade the physical assessment portion of the assessment. Following that, you will be asked to go to another room and complete the documentation for the peer assessment, which counts for another 25 points of the total grade. Again, the top page should have already been filled out by your patient. The remaining portion will be filled out by you, documenting what your findings were from your physical exam. Keep in mind that you will have no assistive aids. There will be no books available for you during the documentation portion of it, so you should be familiar enough with the terminology that you can document this without any assistance. On page 31 of your RNSG 1215 syllabus, there is an evaluation form that we use as a guide to grading the documentation portion of your peer assessment. You might want to read over that and see if it is helpful to you as you prepare for this. There is one other portion of the RNSG 1215 syllabus that you do need to become familiar with early on. Hopefully you've been using this all along. It's called the Integrated Adult Physical Assessment Guide. It's very helpful. It has normal findings, how you would document that, and it has some abnormal variations and how you would document that. This will not be available for your use during the documentation portion of your peer assessment, but it is a helpful tool that you can use not only this semester but throughout your nursing education. I hope that the video has been helpful in preparing you for your peer assessment, and I hope that all the skills that you have learned in the 1215 course will help you in your nursing career. Thank you.